of Basotho visiting or residing in South Africa has raised concerns to the government of Lesotho. In its latest cabinet sitting, Lesotho says it is worried about reports of Basotho being denied access to medical assistance and what seems to be random targeting and arrests of Lesotho citizens in the Republic.
Our appeal is that if you give a Lesotho citizen a visa to be in South Africa for a period of time, this Lesotho citizen would be in South Africa lawfully. That means that the citizen should access the health services because they're already in South Africa. Otherwise, what are we doing? Are we relegating them to death or what? So I think it's very important that if there are changes to, or rather, if there are conditions that we have to adhere to as the citizens who get the permits to be in South Africa, those conditions have to be clarified.
Morosi says while she believes that this might not be an official policy of government, the messages implied is rather unsettling.
It's probably just xenophobic actions by South African citizens. What prompted that, I may not know. But I think the government of South Africa has to stop that immediately.
Minister.
Hello everyone, welcome back. My name is Connie. If you're new here, you're very much welcome. So yeah, today I wanted to talk about this article that I saw online. It's about accessing to free public healthcare in South Africa. So the Zimbabwean Human Rights Commission is in talks with the South African Public Protector, Koleka Galeka, following complaints that Zimbabwean nationals are being denied access to healthcare in South Africa. So, but here's the reality of the story. No one should expect a free public healthcare from a country when their own government refuses to provide it. Zimbabwe's Justice Minister, Ziahambi, recently made a public comment that made it very clear that his government will not pay for Zimbabwean citizens' medical bills in South Africa. Then who's going to pay for those medical bills? If the government of Zimbabwe is saying we're not paying for Zimbabweans' medical bills in South Africa. And I had a look at this immigration in South Africa. So South African Immigration Act expect immigrants to have a healthcare for them, a private healthcare, to have a healthcare that they can use. It doesn't promote free public healthcare because South Africa's free public health system, especially in the historic disadvantaged Black community, is already really under pressure. These clinics were actually meant to repair the damage of apartheid era South Africa, but they're still, even today, underfunded and overstretched. When you really couple with that and add a lot of illegal immigrants getting into those communities, and having to access these services, it creates an additional burden. And community do feel it. The community that live there, they feel that burden. All right. This is not about hate, it's about realistically of what's happening on the ground when this happened. So group like Operation Dudula and March and March really are not calling for violence. And their mission is very simple. They're calling for basic identity verification. And why they want that identity verification is to make sure that people who are accessing this free public healthcare in South Africa are entitled for. They are the citizen of South Africa because that's what they're meant for. They're equity-based healthcare access. Because if, as a South African myself living abroad, if I go to South Africa, I wouldn't be expected to pay. I wouldn't be going there because I work, I have income. I would be expected to have my own insurance, travel insurance. If I don't, I need to go and pay for private help for anything they're going to help me with. And this is the expectation, even with the South Africans middle class. They have their own private help. They don't actually go to these clinics. But with this influx of undocumented, aka illegal immigrants, this has actually overburdened this community massively. So the message for these, groups like Operation Dudula and Mushroom Mart is very simple: is that if you want to use the state-funded services, this equity-based healthcare, you must really prove, first of all, you are legally entitled to them, that indeed you are a South African citizen. That's not hate speech. It's a call for order in a system that's failing. Actually, that's failing the very people it was meant to protect. Uh, it is the same system. I don't understand how this is so hard for authority in South Africa to understand that if you are having an equity-based system, it's meant for the people you are designed for redress. If you allow everybody to access it, you're going to strain it. You're going to strain it. You must limit it, because then other systems like the private health don't get utilized, as we've seen them not being utilized, and people coming to South Africa without that private health insurance that they need to have if they're immigrants. So you need to be working on that system, because this is a system that works here in Australia. As an immigrant, when I first came to Australia, I had to pay for my health. When I see a doctor, it was paid, it was not subsidized. When I go and pay for my medication, it's not subsidized, it was payment system. Even if you're given a Medicare card, your Medicare card is different than the citizen of Australia that you get given when they're immigrants, a visa, depending on your visa supply. But the bottom line is, when you have an equity based system, you really have to protect it, because then you can potentially end up creating more demand in it. And I think this issue here around people going to these free public health systems that were not designed for them, there's actually created demand in those systems. And unfortunately, the people where this system was meant for them, they're not getting service. They often go there, they don't find the medication, they go there, they spend the whole day there trying to get access because other people are in front of them. So, and this isn't just about Zimbabwe, South Africa issue, because even Lesotho national person was talking about this, that the citizen of Lesotho have visa. Yes, they have visa, but they need to make sure that they have private health access. They cannot go to this black community to access this equity-based healthcare. It's not wasn't meant to design for migrants. It was meant for previous apartheid injustice community, redress for the previous community affected by exclusion, apartheid exclusion. So really, I think this is very simple. The simple solution is that everyone needs to get a private health insurance and go to the private health insurance. If they're not citizen, they can go to private health insurance. And even if they are citizen, if they are earning an income, they should be like a card base, like we have here in Australia. You get a certain card, different card base. If you unemployed, you can have healthcare card. If you're not, or if you're earning less than a certain amount, you have a certain card that you can show for. That type of system is a way better system, and you don't have to really reinvent something. You just have to look here, and then you sort this whole problem out, because then it means if you got someone who's undocumented, they've got to make sure they go and get their own. They have see the authority first, and the authority give them a card. And then if they go to healthcare facility, they show them that card. And if that card says it say okay, they're undocumented, and then that documentation should say what they're entitled to access. All right, is it vaccination? Which I think vaccination is important, should be there. Um, and where they should go. It cannot be as this stuff has been happening. You should now bring about law and order and demonstrate to South Africans that you are in charge. I mean, the government of South Africa, the health minister, because this stuff are very simple. They don't. You don't reinvent the wheel here. Don't need to reinvent the wheel here. There are systems here, even in Australia, that are like that. You can really, in make sure you are running a system that is sustainable, Because once these people, many people coming in into this community, and then there are reports of them not getting the essential medicines, and that can be a very problem as well. If people who are maintained on the certain medication, example the ARV, and then they get there, they don't find that medication that helping them, and then suddenly they develop resistance. That's a problem. That would be a public health risk as well, having that no access to the medication that were helping them. So it's a broadly affecting the public health system in general, and it require leadership. Unfortunately, we have an ANC Minister of Health. That's why things are the way they are. They think that just sending police there will solve the problem. It's not a police issue here. It's a policy, not a police. Law enforcement. Law enforcement are required for people who are undocumented, but it's not a who or one documented who are coming with someone else's identity. There's one video that I saw today of someone else going to this clinic with someone else's identity that they've stolen. That is a fraud. That is where you need police to come in. But if it's just people going over there for healthcare access, you need to have a policy, healthcare policy that allow a gradual entitlement for certain groups, and that it needs to be very spell out what they're entitled to. It cannot be that they go to this community, mainly black community, and those community don't even get access to their own healthcare system. So that's where the problem is. So it isn't just about Zimbabwe, South Africa, or Lesotho, because all the citizens are facing the same problem, and even Mozambique would be facing the same problem. Because South Africa has a tariff of 30%, and if you've noticed that the other countries don't have that much tariff. I think Lesotho is 15, the others don't even have tariffs. So if the neighboring country don't have tariffs, there's going to be a lot of unemployment in South Africa. So really, the South African government won't have enough money from the taxation, because a lot of people become unemployed as they are now, to tax them so that they can actually pay for this public health system. So it goes the both ways. So this is a very simple system. It's not about forcing people to go to where they're straining the healthcare system. You can hear a lot of these clever blacks talking, and other white South Africans who are privileged enough to talk about, oh, their best, Dudula is doing that. But have you provided a solution? Have you actually been there to help? Because this is the problem. I can see it from here in Australia. From here, I can see why is the problem. So we've been out there to see where the issue is and be able to provide some solution how we can be sort this problem out, because it needs to be sorted. And you and I cannot solve. I think it needs to be sorted by the government through policy change, because saying justice for everyone is a good and noble, but the constitution itself doesn't say that healthcare is free healthcare. It says healthcare, which we agree, healthcare is for everyone, but not free one. The free one doesn't exist. You got to pay for it. Okay, and you have to be, and to access the free one is a decision of a government. The Australian government decide which people are entitled to free access to healthcare, which conditions. It's similar in South Africa. It's the same thing. The group that were excluded under apartheid for public health care, mainly blacks and colored community and other non-white community, have been offered that opportunity. So you cannot just go there while you're not even entitled. You're not a citizen, not entitled, and try to create problem there. And then when the community starts saying, okay, we need your identity, and calling them xenophobia, that's not in an interest of solving the issue and the problem, because then you're insulting the community by calling them names when they're telling you you're actually not entitled to this healthcare, free healthcare. So we demand that you show us your identity. So this is what has been happening, what Dudula has been saying. Okay, when you enter here, show us your identity. But this issue is really easy to sort it out. From my perspective, is that you need to really have a look and see how you can run a policy that is gradually looking at these issues around access to healthcare, You cannot just say it's for everyone because everyone is great, but who's going to pay for it? If South Africa wants everyone to have access to free public health care, then they need to have a budget that it's for everyone. They need to build hospitals and have employed enough healthcare workers, have enough medication for everyone. But we know even for these limited people just in this community, black townships, healthcare is not accessible for them as well. It's not for everyone. So it's really so dumb to say that, if I may say, that to say it's everyone, to use this term everyone, because everyone must be actually supported by the budget first and by the resources on the ground, meaning human capacity, medication. All right. If those two don't mesh up, and that's why you're seeing this issue that's coming up. So it is really, this is a SADEC-wide problem. And until there is the regional leadership that actually be able to face their own inability to provide basic healthcare in their own community, this problem is going to continue. The burden will keep falling on the poor South Africans, and especially in those poorest community, in those poor community. Government are and so-called, the clever black leaders here talk about it. They really must stop ignoring this issue. This issue need long-term solutions that support all people, including migrants, without overwhelming already struggling community. My concern has always been that black communities don't benefit from high influx of migrants in South Africa because they compete in the same already under resources public system, like your public school, your public health care. So then, and trying to say they're xenophobic when they're trying to protect what's theirs, it's also not genuine in a way. It's very much insulting because the issue that results in this problem, it lies in the fact that the burden of migrants is in the black community, but the benefit is in the elites that who are hiring them, giving them peanuts, don't register them, don't register them so that they can have actually access to healthcare, which is the private health system. Because people who are working have access to private healthcare. Migrants who have employed, they have access to the private health. So they have their own insurance to access that. So if you really deal with that issue, you wouldn't have this problem at all. You wouldn't have this issue. So if, because even with SADC bringing people in South Africa, they've always done that, but they've done it around special, accessing a highly specialized services, and it's usually done intergovernmentally, and they pay through that, not just bringing people without expecting to be treated for free. This healthcare worker needs to be paid, and there is actually a limit of how many people a healthcare worker can see a day. And the statistics that I've seen, it's really, they are very much working under pressure. Many of them will suffer from burnout as a result of this issue. Then you don't really bet what you are actually making your healthcare workforce not wanting to provide services in their own community. That is a problem, and the government of South Africa, unfortunately, it's the ANC. We got still gonna talk about it. They're not gonna ANC people. They're not gonna come out and address the issue head on and provide solution. They're waiting. Their solution is to call police. That's literally like police. People are fool, and you're gonna call police. What for? You need to address it policy wise, and it doesn't even need the constitution to change. It's about policy access. Who access to what? Make it clear, black and white, that you don't this, and make it clear even to those as citizens and the government that you're not going to provide this free healthcare. The people who are coming here, they must have their own healthcare. It's written in the immigration, but it needs to be communicated very clear as a policy of a government, because you cannot say that people should come and access healthcare for everyone. And then where they go, they only go to the black community. That's not for everyone. You're bringing people to just go and harass the black community because they don't want to do that. They are already under resources. So you need to take them elsewhere. If it's for everyone, then they must go even to private if that is the case. But they don't. They go to this community and become a burden, and you start throwing this insult of xenophobia. But while we know that the reason why they're screaming out loud is because of this inability for them to access their own healthcare setting because it's full. All right, so the government and other people must really stop ignoring this. We need a long term solution that supports migrants without overwhelming already struggling community. The compassion must come first with responsibility. Compassion is the first and very important thing that we must all express, but we also be able to understand the strain it creates to these poor communities. Well, it's not just in good enough to just throw this insult of xenophobia by not providing solution about how you're gonna actually deal with overcrowding in those communities. How because the burden is very clear in South Africa. All this burden of migrants, burdens in the black community. So and the benefit is in the elites and the clever blacks and the white community because they hire them and then they don't pay them the minimum wage that so that they can register them and get them to have their own private health insurance. So you see how this has even become a big problem around just administrative around social cohesion because you don't want this such stuff. This is a problem that creates social problem, social discord, people getting upset about it when this type of stuff I'm telling you happen. So it really we can talk as loud and say, hey, this is what needs to happen, but the government of South Africa is the one that's responsible. They need to come up with a solution. Just calling the police is not good enough. And actually condemning the Dudula who are enforcing the law to make sure people who are coming to healthcare have they're entitled to it, they are citizens, and they have valid documentation. It must be clear. And then also the government must be clear about what are they think. Do they think these people need to go to black community alone? Can they go to other community? This also needs to be clear. They can't just be all be put into one community. It has to be clear how they want to manage this. Is a government question, and it must be the solution is a government solution. Condemning Dudula is not good enough. Condemning Mashanma is not good enough when the community themselves are out there celebrating because they can be serviced on time. Since Dudula has been requesting that people who access those services must show that they are citizens of South Africa. So since they've done that, there's been some video online showing these clinics being empty. So people celebrating and say, oh my God, I've been serviced within half an hour. Normal, I'll be here the whole day. You see that kind of things, it suggests to me something isn't adding up. You see, you're not going to win this one. You need to actually look at and see what's happening down there and provide a leadership. Sending police or condemning a group that's helping the community is not going to work. Even having a meeting with public protector, it's not going to work because the solution is already there, demonstrated here. That they actually need to prioritize citizens and make sure that those who are not documented are actually addressed and what is the healthcare can be provided to them and in what way and how the healthcare worker are able to identify them because there's been a lot of allegation of people coming in just to get medication and resell them elsewhere in their countries. So that issue also needs to be addressed. You need to be adding this stuff around, even monitoring the script. Because some of these medication that people have been showing me, they're very suspicious in a way that they could be diverted elsewhere. They could be used to make recreational drugs like, methamphetamine that they go and look for in these clinics. That is also a risk for public health and also, so this issue is a very serious one. It's bigger and it requires authorities to take responsibility to stop blaming people who are trying to sort it themselves. All right, thank you guys. See ya.